And last week I read this very fascinating study by some researchers from the Baylor College of Medicine. And what they did was they examined some samples and did a retrospective study of dengue fever in the Houston, Texas area. And I had the opportunity to speak to the lead author of that study, Dr. Kristy Murray. Let's go ahead and roll that, Bill.
There was an interesting study published recently in the journal Vector-Borne and Zoonotic Diseases that grabbed a lot of attention. The retrospective study examined samples from patients thought to have contracted mosquito-borne diseases in Houston, Texas from 2003 to 2005, and the findings were quite interesting. Joining me now on the phone is the lead author of the study, Dr. Kristy Murray. Dr. Murray is an associate professor and associate vice chair of research in the Department of Pediatrics at the Baylor College of Medicine and director of the Laboratory of Viral and Zoonotic Diseases at Texas Children's Hospital. Hello, Dr. Murray, and thanks for talking to me today about this fascinating study.
Absolutely. Glad to be here.
Okay, great. I'm glad too. Let's go ahead and start. So you and your team tested several thousand CSF and blood samples from suspected mosquito-borne disease patients about 10 years ago. And essentially, what did you find?
Well, so the reason why we wanted to do this study is because we thought that dengue could be here in Houston, but because nobody was looking, we weren't getting any positives. People weren't reporting any cases. And we had, of course, a large number of submissions for West Nile virus testing. And I thought it'd be really interesting to go back to those samples that had been banked to see if they were negative for West Nile, why don't we go back and see if any of them are positive for dengue, since West Nile and dengue clinically can look really similar to each other. They both have high fevers, severe headache, severe joint pain. Many people with dengue can actually have a meningitis-type picture, an encephalitis picture. And so we went back and tested these samples, and what we found was that 47 of them were actually positive for dengue. And looking at those samples, we had positives for all 3 years, 2003, 4, and 5. And what we found was that actually in 2003, it looked like we had an outbreak that occurred. We continued to see sustained transmission in 2004 and 2005, but not to the extent that we saw in 2003.
Okay, and you said was testing for dengue fever, was that the choice of your team in this study?
Right. Well, it was mostly because we thought that would be, of all the different types of diseases that could potentially emerge here in Houston, that would be the one at the top of our list. Mostly because we have, incredibly diverse population. We're a very urban population. We have the right mosquitoes. We've got both Aedes albopictus and Aedes aegypti, so the two type of mosquitoes that can spread dengue. And then just knowing that we have so much traffic back and forth to endemic areas, that easily somebody could come into the Houston area, be positive for dengue, have virus still in the blood, have one of our mosquitoes bite that person, and end up causing a transmission cycle. So we just felt that it was definitely one of the ones we would be most concerned about. And just knowing that doctors here more than likely wouldn't know to be looking for it or to be testing for it. And so we, not 6 hours away from here, there's plenty of transmission activity occurring. And we thought, well, why not Houston? So we went and looked, and sure enough, we found.
And does Houston have a history of dengue?
It does. Actually, we had a massive outbreak here in the 1920s. Over 500,000 cases along the whole Gulf Coast area. Started in Galveston and spread its way around. And so we'd had dengue before, but really in the 1950s when there was a lot done in terms of mitigating mosquito populations, we didn't know if we would still have any issues in terms of dengue or not. I mean, from what we thought it was gone, but again, nobody was testing for it. Nobody was looking for it. And so it was just, one thing that we thought would be important to do with this study.
Sure. And how did you and your team differentiate locally acquired dengue from those associated with international travel?
Good question. So what we did is we went back and looked at the medical records of the positive cases, and we looked to see if any of the physicians had noted any kind of travel history or not. Oftentimes if a person comes in, especially if they do have an acute febrile type illness, oftentimes the physicians will ask them if they've traveled anywhere. And so we gained it from the medical records, but then we went an additional step and actually contacted these individuals to ask them if they had a history of travel. It was a little bit more sketchy just because we thought, we're asking these individuals from an illness they'd had years before, whether or not they'd had any history of travel in the 2 or 3 weeks before they got sick. But for the most part, none of them had, especially none of them to an endemic area. We only had 2 people in the outbreak who had clear history of travel to Mexico just before they got sick.
Okay. In addition to the blood samples, what other type of sources of data did you look at for this?
So we went back, we looked at the medical records just to see what exactly their clinical picture looked like so we could better understand, do these cases actually fit what we would expect to see with dengue? And pretty much they all did. There were 18 of the cases that clearly met the case definition, meaning that they needed to have high fever, they needed to have the headache, joint pain, muscle pain, and what we think of as being kind of a classic dengue sign, which is really severe pain behind the eyes. We call it retroorbital pain, and then the rash. And so we had 18 that fit those criteria, and then we had the others that, again, the doctor might not have written in the record that they had, muscle aches or joint pain, but otherwise they still had the fever, and many of these individuals actually had what looked like meningitis. So the more severe cases of dengue, I would say.
Sure. And I'm kind of curious, what kind of reaction from the study are you getting from the Houston community?
Well, the thing is that when we started the study, just from our own perspective of the group involved in this, in doing this, we had both health departments involved. We have a city and we also have a county health department here. We had them, we had the mosquito control district involved, and then we also had CDC dengue branch. And so it was a pretty massive collaboration going through and looking at these samples and looking back at these cases. And so we had everything in mind before we went forward publicly with the information. Here in Houston, of course, the reaction is, oh, great, another one for us to worry about now. We already have West Nile, and we have a lot of West Nile. West Nile's, we've always had cases here every single year.
Especially last year. Mm-hmm.
Yeah, last year was really tough. And so it's like, great, now we've got another one, and now we basically have 24/7 of mosquito protection, that we have to be thinking of, because of course the mosquito that spreads dengue is the one that's more out during the day versus West Nile, where you have more the nighttime feeding mosquitoes that are involved. And so that's just been our message: just keep yourself protected from mosquitoes. But the problem is here in Houston, and I know you're in Florida, so you probably have the same thing. It's impossible to be 100% protecting yourself against mosquitoes here. I mean, you just go out to your car, go get mail, and you've gotten bit. I mean, it's just, they're, especially these daytime feeder ones that can spread dengue, are the ones that are incredibly aggressive here.
Yeah, it's kind of interesting because right now, and you're probably aware of it, on the other coast, the east coast of Florida, they're dealing with locally acquired dengue cases. It's now about 21 cases. So you may have heard about that in the news. Yeah.
I've been very involved with knowing what's going on in Florida and how it's spreading upwards as well. So from going from the Keys upwards. And I think, again, it's really more looking for it, because, that's one thing that was learned about that first outbreak that occurred down in the Keys was that it was because a doctor up in New York thought, maybe we should test this person for dengue, not because she had traveled to an endemic country or anything, just because that particular clinician happened to know exactly what dengue looked like and think about it. And sure enough, then when they went back and looked at people there, that's when they found all the positives, not because people were actively sick in the hospital. So kind of the same thing where these cases can easily go unnoticed. You've got a really severe viral illness. We don't know what it is. Here in Houston, 80% of our encephalitis cases that are caused by some sort of viral infection go completely undiagnosed as far as what caused the infection. We know they have viral encephalitis, but for what we classically test for, all those things are negative, so we don't know what it is. Of course, dengue was never on that panel of things to test for that or for meningitis. And so it's helping us to open our eyes to things that could be potentially going on here in our own backyard that we just don't think about.
Okay. I'm getting short on time, so I want to get down to the brass tacks. Mm-hmm. Was there a dengue outbreak in Houston in 2003?
Yes, there was, most definitely. And I think, as we were going through looking at these cases in 2003, what we call the epidemic curve, meaning your cases over time, fit beautifully for what you would see for an outbreak. And one of the cases was a death. A woman who was an elderly woman, lived in one of the poorest areas of town here in Houston, had a hip replacement surgery about 2 years before she got sick. And she was completely bedbound, could not leave whatsoever. And we got a CSF confirmed positive, IgM positive, which for us is, that's it. That's all we need to confirm her case. And so for her, she had to have been the clearest example of somebody who had absolutely zero ability to travel outside of the Houston area.
Exactly.
And so that was kind of the nail in the coffin for us for saying, this is no doubt something that was locally acquired. And for us, we got 2 people who were actually PCR positive for dengue serotype 2, meaning they actually still had virus in the blood.
Right.
And what we got positive is a bit different from what you see in Florida. That's a type 1 strain that's circulating there.
Yes. This is absolutely so interesting. I want to thank Dr. Kristy Murray with the Baylor College of Medicine for taking the time to discuss the study with me. Thanks, Dr. Murray, and have a great weekend.
Thanks.
All right, you take care.
You too. Bye-bye.
Yeah, and if you're interested in taking a look at that study, you can go to theGlobalDispatch.com and in the search box, put in dengue fever Houston and take a look at it. It's really, really interesting. And she was very authoritative about her answer. Yes, there was a dengue outbreak in Houston in 2003. And I appreciate Dr. Kristy Murray also coming on the show to lend her expertise. And if you